And leading into hormones, I love to talk about hormones and hormone replacement therapy. But what is HRT?
So hormone replacement therapy, usually when we say that, we're talking about for perimenopause or menopause. So people think about estrogen and or progesterone to help with things like, not just like hot flashes and night sweats, but all of these other symptoms that come along with perimenopause, menopause, vaginal dryness, bladder issues, low libido, et cetera.
Now, when you talk about hormone replacement therapy and PCOS, do you think it can help PCOS, and in what ways?
So PCOS is something we're learning about more and more. How does it interact with perimenopause, menopause? And we don't have great answers yet. I think that's something where the answers are still to come. But things like the hormone replacement therapy can help with, like evening out levels of hormones. The progesterone in HRT can help with some of these symptoms like, the irregular periods, the mood fluctuations, et cetera.
I love that you talk about the mood because a lot of people don't attribute mood to hormone imbalances, and bringing that back in is really, really key so people don't feel alone or unheard. Now, HRT has gotten a lot of bad rap for maybe the last 20 plus years. Just quick question, is it safe?
So this is something that, yes, it is overall very safe, much safer than we previously had said that it was. So, now we know, especially when you look at younger women, we're in our 40s, 50s.
We're those younger women.
We're younger.
We're the younger women.
So women in their 40s and 50s who are oftentimes the ones who really need the HRT for some, really extreme symptoms, have a much lower risk of things like breast cancer automatically. So, it is much safer than we had previously thought. And especially when you look at different types of HRT. So, we could do a whole episode on just that, but very important to look at, the different types of HRT. Vaginal estrogen is way less risk than almost everything else. And of course, we personalize it to the person. So if someone has a really, really high risk of breast cancer, we treat them a little bit differently. But like I said, we always have to center the patient. We have to be more nuanced.
Now, shedding light on progesterone, we talked about how HRT might be helpful for PCOS and the progesterone levels. Is progesterone the hormone that's being replaced? How does it work, and how often do you give it? Do you give it cyclic? Do you give it continuous? What would you do from a hormone replacement standpoint of progesterone and PCOS?
Yeah. So progesterone for HRT, we oftentimes will think of it as a protective effect. If you give estrogen, which is really, really good for your hot flashes and night sweats and brain fog, if you give estrogen by itself, it can actually increase your risk of uterine cancer. So a lot of times for HRT, we're giving progesterone to protect your uterus, but it also has a lot of benefits in terms of sleep. That's actually a huge one. Progesterone, which we often give for HRT, is really good for helping people sleep, which again can help with so many other health issues. So we give it usually once a day at bedtime. For someone who hasn't fully gone into menopause yet, we may do it cyclically, meaning that you might take a break, give yourself a period. But in general, we can also give it every single day.
I tend to do both depending on what the patient's looking for. Continuous seems a little bit easier because then you don't have to forget when to take it, but both are really, really helpful. Now, do people normally do HRT during perimenopause?
Yeah, so this is something, again, that we're raising awareness about. In general, we ask about symptoms. We see if they have things that we need to treat. But also now a lot of people are looking into, is it helpful for prevention? Like we know that HRT in younger women is cardioprotective. It can decrease their risk of heart disease. So again, we're gathering more data, we're learning more and more, and then we're listening to what women are looking for in their own health, and then we help them decide.
I'm really glad that we're at that point, especially seeing HRT from the days of when it was scary and to now just how beneficial it is. It really is helping women with their lives currently with symptoms, but then also looking forward at some of those conditions that we can actually help prevent. So what can people expect when they do HRT?
So obviously, we kind of try and manage expectations. Like there are sometimes people almost look like it's like a magic wand. Like you take it and like you're rejuvenated.
Right.
There are some things that do respond relatively quickly. So things like hot flashes, night sweats, within a couple of days, you may feel better or they may disappear. Some of the other issues like mood symptoms, libido, weight, like that can take a lot longer and they may or may not improve. So we always tell people it all depends on the person. You have to kind of give it a shot. There are sometimes times it can take 1 to 3 months to kind of feel the optimal effects. Some things, like I said, you may feel a lot sooner. So it is about kind of managing expectations, like kind of knowing that it's not a magic wand, it's not instantaneous, but some of it is over a long time. It may help to kind of preserve your health, or start to kind of change some of those symptoms. Your skin, your muscle,
Right.
your bones. Those are obviously much, much longer term.
I think everyone comes in with a different laundry list, so you have to manage expectations, but also that this is the long game. Like this is your life. It's not just tomorrow you're going to be a completely different person and feel completely when you were 20 years old. That's not even the goal. The goal really is, how can we make your life where you are right now better, and how can we improve some of the outcomes coming down the road? Are there any negative side effects like acne, fertility issues, or weight gain when we think of HRT?
So usually for HRT, we aren't giving it to somebody who's trying to actively get pregnant.
Right.
So it's not as effective as birth control. It's actually weaker versions of the hormone.
Much weaker.
So we do tell people it's not a birth control. There are sometimes we will use birth control as HRT to give someone hormones if they also want to stop ovulation and preventing pregnancy. But in general, it also, the bigger kind of risk factors we think of are things like, breast cancer. If someone, has a history of breast cancer themselves where their body responds to hormones in a negative way, that may be somebody that we obviously cannot give systemic HRT to. If someone's had an actual blood clot in their veins or their lungs, we can't give them HRT with estrogen especially. So there's something, like I said, we have to kind of personalize it to the person, but it actually remarkably has relatively few side effects compared to birth control, which people may be scared because they maybe took birth control pills and had a lot of mood symptoms or, acne or skin issues. They may think the same about HRT. I do find, and you probably do too, people tolerate it much better because it is a weaker version.
It is just a low level, and it's really there just to kind of create this nice buffer rather than the higher levels that we see in birth control.
Exactly.
Stay tuned for more discussions with leaders in women's health. Remember to subscribe to our channel and follow us wherever you get your podcast. And with that, I want you to stay well, and I'll see you soon.